All right, let's get right into it. Today, we're talking about building your financial fortress. We're going to take the often confusing world of health and accident insurance and turn it into a simple, clear blueprint for your financial security.
So, let's start with a pretty serious question, and I want you to be honest with yourself. Could a single accident or illness completely wipe out your savings? For most of us, the answer is a kind of scary yes. An unexpected health crisis can be absolutely devastating financially, but it doesn't have to be.
And that's exactly where our fortress comes in. Think of insurance as the blueprint we're going to use to build these strong walls of protection around your finances, making sure one really bad day doesn't undo years and years of your hard work.
Okay, so every good blueprint has to start with clear definitions. First things first, let's get inside the mind of an insurer and understand how they think about risk, starting with the really key difference between an accident and an illness.
Insurers use this key term, morbidity. It sounds a little clinical, right? But all it really means is the statistical chance, the probability, that you might get sick or injured. This whole concept, this idea of morbidity, is the foundation for pretty much all health and accident policies.
Now, this is fascinating. The actual definition of the word accident has evolved over time. The older, much more restrictive definition was called accidental means. For a claim to be paid, both the cause and the injury had to be accidental. Today's standard, thankfully, is accidental result, which is much broader. It only requires that the injury itself was unintentional. And believe me, this is an absolutely crucial distinction.
This example just makes it all click. So picture this. Someone intentionally jumps from a second-story window and gets hurt. The act of jumping? Totally intentional. Under that old means definition, the insurance company would pay nothing. But under the modern results definition, because the injury wasn't the intended outcome, the policy would most likely pay out. It just goes to show you how one little word in a policy can make all the difference in the world.
Okay, we've got our definitions down. Now let's start building the first major wall of our fortress, protecting you from the incredibly high cost of medical care.
Medical expense insurance is really the cornerstone here. It's the part of the plan that reimburses you for the big-ticket items. We're talking hospital stays, surgeries, doctor's visits, and all that other outpatient stuff. Without it, even what seems like a minor medical issue can just drain your savings in no time.
This brings us to a really fundamental trade-off, a choice that everyone has to make. There's a direct link between how much you pay every month, your premium, and how much you pay out of pocket when you actually need care.
So here's how it works. A deductible is simply the amount you have to pay first, before the insurance company starts paying. Coinsurance is the percentage of the bill you pay after that deductible is met. So, if you're willing to take on more of the risk yourself, say a higher deductible and a higher coinsurance percentage, your monthly premium is going to be lower. If you want lower costs when you go to the doctor, well, you're going to pay a higher premium each month. A good way to think about it, if you're young and healthy, a higher risk plan can save you a ton of money. But if you have a family or maybe some chronic health needs, that lower risk plan is often worth every penny of the higher premium.
All right, wall number one is in place. But it's one thing to cover the medical bills, right? What happens if you can't even work to earn an income in the first place? This section is all about protecting your paycheck.
And this is exactly what disability insurance is for. Now, listen closely. It doesn't pay your doctors, it pays you. It gives you a steady stream of income when a disability keeps you on the sidelines, essentially ensuring your single greatest asset, your ability to earn money.
Okay, let's clear up a huge misconception. So many people think, oh, if I get hurt, Social Security will cover me. The truth is, Social Security has a very strict definition of what disability is, and it's tough to qualify. You should really only think of it as a secondary safety net. Your own private disability plan, that's your primary line of defense.
Let's make this real. Let's say you earn $3,000 a month before taxes. A pretty typical disability plan might pay you about $1,800 a month. Now, I know what you're thinking. That seems kind of low, but there's actually a very smart reason for it. See, if you pay your disability insurance premiums with your own after-tax money, any benefits you receive are completely income tax-free. So that $1,800 benefit, it's designed to be very close to your actual take-home pay after taxes. The whole structure is designed to replace your net income without creating an incentive for people to stay out of work. Pretty clever.
One last key term for this section is the elimination period. This is just the waiting period before your benefits start to kick in.
The easiest way to think about it is like a deductible, but instead of being measured in dollars, it's measured in days. And just like a deductible, a longer elimination period means a lower premium for you.
So, we've built the main walls of our fortress. We've protected against medical bills, and we've protected your paycheck. Now, let's add the specialized reinforcements that really complete the whole structure.
Dental insurance is kind of a unique piece of this puzzle. It is heavily focused on prevention. In fact, a lot of plans will cover your routine exams and cleanings with no deductible at all because they want to encourage you to catch any problems early before they become big, expensive ones.
Then there's long-term care insurance, or LTC. This is for when you need help with the basic activities of daily living, often because of chronic conditions like Alzheimer's or Parkinson's. The focus here isn't on curing a disease, but on providing support to maintain the best possible quality of life.
And finally, we have A&D, which is really the purest form of accident insurance out there. It's very straightforward. It pays a big lump sum of cash for an accidental death or for the loss of a limb. You can often get it as its own standalone policy or sometimes as an add-on called a rider to other coverage.
So there you have it. We've walked through the entire blueprint, from the core definitions all the way to medical coverage, income protection, and these specialized policies. All of these pieces, they work together to protect you from the unexpected. So the question to leave you with is this: is your financial fortress built to last?